Uganda begins to ease lockdown restrictions, allowing shops and restaurants to reopen. Mozambique reports its first coronavirus death in the northern province of Nampula. Plus, pupils are back to school in Cote d'Ivoire after the coronavirus shutdown. Thank you for joining us this hour. Welcome. I'm Layo Adegoke. We begin our coronavirus coverage with the top figures from Africa. The continent has recorded 116,297 cases. From that figure, more than 46,000 people have recovered, and the death toll stands at over 3,400. South Africa has the highest number of cases in the continent, with 23,615. It's followed by Egypt with 17,967, then Algeria with 503. In West Africa, Nigeria has recorded 8,068 cases, followed by Ghana, which has seen 6,808 cases. Meanwhile, the countries with the most fatalities are Egypt with 783, Algeria 609, and South Africa 481. Well, in the light of this, Uganda has begun easing lockdown restrictions, with private cars expected back on roads and shops and restaurants reopening. But everyone is encouraged to adhere to the wearing of masks in public and physical distancing. President Yoweri Museveni last week delayed easing of restrictions to give people time to acquire the face masks. The restrictions will only be eased in 95 out of 135 districts, with 40 border districts still restricted. Gyms and nightclubs remain closed, and public transport restrictions will be eased on the 4th of June, the same day guidelines on the reopening of schools will be announced. Meanwhile, 7 out of 25 lorry drivers who escaped from coronavirus testing centers on Uganda's border with Kenya have all been arrested. The authorities in Uganda say the 7 people were found in Indiba area on the southwestern edge of the capital, Kampala, which is actually 191 kilometers from the border. The drivers had been tested at Elegu and Mambala border posts, where their results came back positive for COVID-19. In Kenya, 2 lorry drivers who escaped from a testing center before their results came out were intercepted in the lakeside city of Kisumu, a 2-hour drive from the border, and they were put under isolation. The drivers, one from Uganda and the other from South Sudan, entered the country through the border at Busia, and they both tested positive. Or pencils, books, bags, and now masks. School children in Cote d'Ivoire are finally going back to class after 2 months of lockdown. This makes the country one of the first West African nations to reopen schools. Students are being transported from the city of Abidjan, which is the epicenter of the country's outbreak, to the provinces, raising concerns that the reopening could spread COVID-19 to the country's hinterlands, which have so far been spared.
Thousands of masked children flock back to school in Cote d'Ivoire's commercial capital, as the country becomes one of the first in West Africa to restart lessons after a 2-month hiatus due to the coronavirus pandemic. The reopening of schools means thousands of pupils and their teachers must be ferried back to boarding schools outside Abidjan, which has become the epicenter of the pandemic since the first case was confirmed on March the 11th. French teacher Patrick Cote waited with hundreds of others in the sun-baked stadium to board buses out of the city on Friday.
We're living worried because we don't even know if we have the coronavirus ourselves. And we don't even know if the kids are infected over there either. It's very hard. We're living very worried.
With a total of 2,376 cases and dozens of new infections confirmed each day, the country is yet to contain the virus. But the authorities are confident pupils can study together in safety after the introduction of extra hygiene measures. In Abidjan's Adjamé neighborhood, children in backpacks queued to wash their hands under a teacher's watchful eye before entering their school, where they sat just one to a desk with bottles of sanitizing gel within reach.
We came to check how it's going. Are the measures really followed? How are our children being taken care of? It's really important. That's why I'm here today.
The school has reorganized the schedule so that students are able to respect the safe distances in classes.
What changed is normally children start at 7:30 a.m. and finish at 11:45 a.m. to have lunch. Today, they will be in class until 1 p.m. continuously, and then they go home. For other classes, like the 5th grade, one group will come in the morning and the other in the afternoon.
With millions of children still stuck at home, aid agencies say the children has warned that many could face serious setbacks due to the limited options for distance learning in parts of sub-Saharan Africa.
Now let's bring in Liane Dobasson-Pierre. She's a journalist based in Cote d'Ivoire to discuss more on this. Thank you so much for speaking to us.
It's very good to be on the show this afternoon.
Thank you. Well, Cote d'Ivoire has over 2,000 cases, but the students are back at school now. Are citizens comfortable, especially parents, with, releasing their kids back to school?
It's, of course, a very emotive issue, sending your children back to school and relying on government's assurances that they will be safe at school. But the government has taken several very important measures. Firstly, they opened up schools in the interior last Monday already, where no new cases had been reported since the 21st of April. Schools in the epicenter of the virus in Abidjan, as mentioned in the previous report, opened on Monday. So there are specific days in which schools or kids need to go back to school. They're not there for the entire day. There's no recreation, for example. So there are certain measures and certain assurances that have been made by the schools themselves, by the health department, and by government as a whole.
All right. You've mentioned that the government, has many assurances to the parents, but these reopening of schools, does it affect only the pupils, or the other secondary schools or universities are also involved?
Most schools, I would say, have decided not to open their maternelle, as what they'd call it, for the little kids as yet. They've started with primary school, secondary school, especially the learners that are either going to university next or are going to secondary school next. So they're focusing on those learners. They have arranged the timetable that you're only at school for 2 or 3 times per week. Thereafter, you have Zoom lessons. The government of Ivory Coast has also been very proactive in offering lessons to students via television, through Radio Télévision Ivoirien, that's the state broadcaster, on radio and on television. And so when children are at school, they have half the number of kids that would usually be in the classroom at that time, thereby allowing them to have the 1 meter at least safe distance from each other. There's no recreation, as I mentioned previously, where they would be in closer proximity to each other. Also, no school meals are being offered. So children have perhaps maybe 1 or 2 hours longer at school, but no recreation and no meals included in that time that they spend at the school.
Well, okay, tell us more about, the steps taken by the Ivorian government in tackling COVID-19.
So the Ivorian government, as I mentioned earlier, were very proactive after the first case was recorded on the 11th of March. The very next week, schools were closed, universities were closed. There was a curfew that was instituted. And so it's been 2 months now that children have been doing distance learning. It's not like no learning was taking place at all. And those measures have now been relaxed quite a bit. Schools, restaurants have all now been opened in the interior as well as in Abidjan. The state of emergency, however, remains until the 31st of March, as well as bars and nightclubs will remain closed until, the 31st of May, rather. Bars and nightclubs as well remaining closed until the 31st of May. But for the rest of it, now groups of as many as 200 can gather, as long as they actually keep the safe distance of 1 meter between them, obviously wearing masks, practicing safe hygiene. So a number of the measures have been relaxed, and of course that would mean that the numbers will spike. But we've seen relatively low cases in Ivory Coast compared to elsewhere on the continent and elsewhere in the world. Also, the government very satisfied with their recovery rate. Already 1,257 people have recovered from the virus, and they're hoping that this rate increases as the time continues.
All right, we do hope more and many more people, recover from this virus. But Leanne Dobasom here, journalist in Ivory Coast, thank you so much for speaking to us. Well, Mozambique's National Director of Public Health has reported its first coronavirus death, a 13-year-old boy from the northern province of Nampula. The southern African country has also confirmed 15 new cases, bringing the total number in the country to 209. The new cases include a health worker who was diagnosed with COVID-19 in the northern province of Cabo Delgado. The authorities have now decided to test all 5,000 health workers in the mineral-rich province, the worst hit by the pandemic. Now, a Burundian refugee in Kenya who has been making and selling soap since 2015 has scaled up production and reduced prices so more people can use soap to wash their hands to help prevent the spread of coronavirus. The coronavirus pandemic has left many people feeling helpless, but Innocent is an example of someone who saw an opportunity to make a difference and took it.
This refugee soap maker is working overtime to help fight coronavirus. When Innocent Havyarimana, a Burundian refugee, first heard hand washing was crucial in preventing coronavirus, he did something few businessmen would do. He lowered his prices. Fellow refugees, aid workers and Kenyans in the local community buy the products made at his small workshop in Kukama camp.
On my side as a soap producer, first, I decided to put on a lower price so that each and everyone will be able to afford the soap.
Kenya is seeing a rise in cases, but none have been confirmed in refugee camps. Havyarimana has a diploma in chemistry and worked for a chemical company back home. He used those skills to establish a range of products, including soaps, bleach, and shampoo. The products are certified by the Kenya Bureau of Standards.
Coronavirus affected the world, plus this Kakuma refugee camp. Most of the refugees are fearing so much coronavirus. That is why now you can't find more than 3 people who are in the same place.
Havyarimana is not only supplementing the supply of soap, he's also making and selling hand sanitizers with aloe vera, which he has planted at his workshop outside his house. The camp in northeastern Kenya hosts close to 200,000 refugees. Development and private sector investment boosts the economy and help the soap business thrive.
Thanks for staying with us. Back here in Nigeria, the federal government has donated personal care and protective items to thousands of Cameroonian refugees seeking asylum in Cross River State. The United Nations High Commissioner for Refugees, UNHCR, in collaboration with the National Commissioner for Refugees, Migrants and Internally Displaced Persons, made the presentation of buckets, hand sanitizers, soaps, face masks, among others, to displaced persons at the Adagom Refuge Camp in Ogoja local government area of the state.
The refugee settlement is located at Adagam and Ukende, Akpapanga, in Ogoja local government area of Cross River State. Thousands of refugees are camped there. To ensure the environment is spick and span, the refugees are presented with cleaning agents and other products from the federal government. They are also encouraged to up their hygiene and observe the measures put in place by the government to prevent COVID-19 and its spread.
We are here in Ogoja to do distributions to the refugees living here. So we came in from Abuja to give them supplies for COVID-19 since they are part of us. So we feel as a family we have to protect them too. That's why we came for the distribution.
UNHCR's role is to provide support to the government. As you can see, the government has given land and refugees are having now shelter settlement in the settlement, and UNHCR provides support, assistance to the refugees.
The grateful refugees still appealed for more welfare packages to help reduce the effects of the pandemic.
I thank God for the one way it come out, and I still pray, make things they begin come, many make it help with small.
I received my articles so and I did not really check them. I don't know their names. They are here in my box.
According to the UNHCR, Cross River State plays host to over 70,000 refugees, and the agency intends to strengthen the COVID-19 awareness within the camp. The high point of the event was a visit by the team to the water project at some settlement and the quarantine center.
The government in Mozambique has launched a free coronavirus hotline to reduce the number of people physically visiting health centers. Callers can dial the switchboard on 110 for information and counseling. They are also encouraged to report people who are flouting quarantine or self-isolation guidance. 6 doctors will work in shifts, and the Health Ministry expects they will receive about 2,000 calls per day. The project costs $100,000 and has been financed by the international partners. The switchboard is installed inside the Mavalane General Hospital on the outskirts of the capital, Maputo. Well, in the same vein, a new hotline is helping families survive domestic abuse in the Democratic Republic of Congo. Calls to a domestic hotline in Kinshasa have exploded during the period of confinement, unemployment, and the restriction on movement from lockdowns and curfews to stop the spread of COVID-19.
Ça, c'est, on peut dire, notre secrétariat technique. Nous avons Madame Nadine et Monsieur Ramadan.
Lacking funds for a proper call center or refuge, Maria Lucasa and a small group of volunteers use their own mobile phones as informal hotlines in Kinshasa and the Democratic Republic of Congo, DRC, to help families reach medical, legal or psychological care.
Bonjour, madame.
It's difficult to gauge how many families in Congo are suffering increased abuse as a result of the knock-on effects of the outbreak, which has infected over 2,000 people and killed 67 since the first case was detected in March. Restrictions on movement and reduced access to help have resulted in a dramatic drop in the reported cases of violence against women and girls around the world. This is according to an analysis by the International Rescue Committee.
Il y a les mesures d'accompagnement dues à la crise sanitaire COVID-19.
As we continued with our campaign, and with the arrival of COVID-19 here, we noticed that we would receive more than 10 to 15 calls a day, whereas before, we would get 5 calls a week.
Around the world, policies aimed at slowing the spread of the novel coronavirus have created a time to reconnect with loved ones at home over bread baking or board games. But for some, such as case K1B1, it meant being locked up with her abuser.
It was the president of the NGO who came to my help. She really listened because I couldn't talk. I was there frustrated, scared that if I dared to open my mouth, it would not be good at all for me and my children. I was vomiting blood because of the blows and mistreatment.
In a society where women often have low social status, research by the UN's Children's Fund shows that domestic abuse is often seen as acceptable in Congo, even by women, according to Pierre Ferry, head of child protection at UNICEF. Movement restrictions, loss of income, isolation, overcrowding and high levels of stress and anxiety are increasing the likelihood that children experience and witness physical, psychological and sexual abuse at home. Volunteers from the call centre, funded by a Swiss benefactor, go door to door on awareness campaigns in an effort to end the silence. For Lukasa, a holistic treatment means caring for the medical, judicial, financial, as well as psychological needs of victims. Now, the call centre is operational, she says. The next step would be to build a refuge to protect the victims from further abuse or destitution and start the process of healing and getting judicial redress.
As part of measures to contain the spread of coronavirus, Kenya's government closed sporting training facilities in March, to curtail the spread of the virus, leaving athletes like Taekwondo champion Vincent Ochieng with nowhere to train. Ochieng was looking forward to representing his country at the World Taekwondo Championships in China in October. He usually trains in school sports halls in Western Kenya of Kisumu, but now he's working out with hundreds of others on the gritty surface of his city's biggest highway flyover.
It is one of Kenya's busiest motorway flyovers, which cuts through Kisumu near Lake Victoria. This left Vincent Ochieng and others with little choice but to find somewhere to train. He trains here with his daughter Stacy. He expected to be competing for Kenya at the Taekwondo World Cup in China later this year. Instead, he's working out on the gritty, polluted flyover.
This year we were planning, and that's why I'm training here. That's why I'm here today. We are planning to represent our country in October. That's China World Cup, Taekwondo World Cup. But unfortunately, this COVID-19, we don't know itaisha lini. We are just praying and hoping itaisha before that time.
The Kenyan government closed gyms and all other sports training facilities in March as part of the measures to contain the spread of the coronavirus.
As we end the program today, Ghanaian World War II veteran Private Joseph Hammond has raised around $19,600 to support COVID-19 frontline workers and vulnerable veterans. Private Hammond was drafted into the Royal West African Frontier Force, aged just 16. Now he's 95 years old. He has walked 2 miles every day for 1 week in a charity fundraiser. The veteran says he was inspired by Captain Sir Tom Moore, a fellow World War II veteran who has raised over $35 million for the UK's National Health Service. Private Hammond was joined in the walk by a number of Ghanaian celebrities and the British High Commissioner to Ghana, Ian Walker. He also received financial support from citizens in the British Army network. The walk ended on Monday, but the fundraising campaign continues. And that's where we end the program today. Thank you so much for watching. I'm Layo Adegoke.